An abnormal smear test merely indicates that cells have been picked up that may indicate there is a precancer of the cervix. So the usual causes of an abnormal smear is infection with human papillomavirus, or HPV, and that's actually what we're testing for in the first instance. If the HPV test is positive, then we actually look at the smear to look for cellular changes in the cells that may indicate there may be a precancer. So when women attend their GP or well-woman clinic, they attend for a routine smear. When women attend the surgery, the nurse or the doctor examining them will obtain a sample of cells from the cervix. They get sent away to the laboratory, and those cells then are analysed to identify if there's any evidence of HPV infection. If the smear test contains HPV infection, then the laboratory will then further analyse the cells to identify if they can identify any abnormal cells or a suggestion of precancer. And depending on that grade of abnormality, that will then determine whether women need a referral to the colposcopy service. So the next step is, having had a smear test performed, is to wait for the result to come through from the screening services. If the smear test is completely normal, then women are usually called back for a routine smear 3 years later if they're under the age of 50, or 5 years later if they're over the age of 50 but younger than 64. In women who've had an abnormal smear test, the outcome may be either to come back for a repeat smear in 12 months if only HPV infection has been identified but there aren't any abnormal cells, or the smear test letter will say you need to be referred to the colposcopy unit, and that takes place if, in addition to HPV infection, we've picked up abnormal cells or a suggestion of precancer cells. Not necessarily. So common things are common. We know having an abnormal smear is very common. Over 400,000 women every year in England and Wales will have an abnormal smear. It can be an indication of a higher risk problem such as cancer, but the smear test is not designed to pick up cancer. The other thing to remember is the smear just gives reassurance about the cervix. It's not designed to pick up ovarian problems or uterine/endometrial problems. It's purely a screening test for abnormalities on the cervix.